Today we're going to be doing a transfer video. Our patient today is Mr. Ed Monroe. He's a 75-year-old male. He lives alone and has recently undergone a right total hip replacement. We are going to be teaching him and you guys how to transfer from his bed to his wheelchair and his wheelchair to his bed.
I'm going to be the PTA today, so before entering his room, I will have washed my hands before I interact with the patient or begin any treatment, and then I'll go ahead and introduce myself to the patient and go through a little bit of the setup of what we're going to do. Hi, Mr. Monroe. I'm Lara. I'm going to be your PTA today. We're going to see if we can go ahead and teach you how to get from your bed to your wheelchair and then from your wheelchair back to your bed safely. Does that sound good? Okay, great. So beforehand, I'm going to go ahead and set up what we're going to need to do with the wheelchair. Before we start, I'm going to go ahead and set us up for the transfer. So I'm going to be taking the legs off your wheelchair and one of the armrests off so nothing gets in our way as we go ahead and transfer you. So to do this, you will bend down for good body mechanics, pull on a lever on the side of the chair to unhook one, and then you're going to want to set this on a bedside table or something that you could have in the room. We don't have a bedside table next to us, so I'm going to be just setting it on this bed. And then you're going to do the same with this wheelchair leg. You might have to move the wheelchair away from the bed a little bit. And lastly, we're going to be moving the armrest that's closest to the bed off so that when we transfer him, it doesn't get in the way. So, to do so, there's a button here in the back that you're going to want to push on. And it should just lift up. Okay. And set that. And the brakes are on. I'm going to reposition the wheelchair so that the wheels are in good alignment. You're going to want them facing forward and not to the side. And now we're going to go ahead and put the brakes back on. You want to make sure the brakes are securely locked before you begin the transfer. Okay, and next is a gait belt. This we're going to put around the patient so that I have something to hold on to as I'm transferring him, and it can be done safely. And you'll inform the patient of what you're about to do. So, Ms. Monroe, to transfer you, this is a gait belt. We're going to need to put this around your waist so that I have something to kind of hold on to as I transfer you to the chair. That sound okay? Okay. So, if possible, I'm going to have you kind of prop up on your arm some when I tell you to, just so I can slip this under and around your waist. I want you to be very careful not to flex your hip too much, because as you know, that's one of your precautions and you can't go past 90. So just slightly elevated on your arms, and I'll slip this underneath you if you're ready. Good, perfect right there. I'll reach and slide this underneath and reach through the other side. Slide it through the teeth and twist it. Doing okay? You can lay back down, and then you're just going to tighten this and make sure it's nice and secure. Too tight? Feel good? Okay, great.
Go.
Before beginning the transfer, it's a good idea to ask your patients if they can tell you what their hip precautions are. Because Mr. Monroe lives alone, we want him to be as independent as possible, but also as safe as possible. And so him telling me what they are shows me that he doesn't rely on us telling him what he can and cannot do. So, Ms. Monroe, before we begin getting you up to sitting or into your chair, do you know what your hip precautions are?
Yes.
Do you mind telling those to me?
I can't turn my leg inward. Can't bring it too far over to the next leg, and I can't bend over past a certain point, and I can't bring my legs up to my chest past a certain point. So I can't bend over too much, and
Great. So his precautions are he cannot flex his hip past 90 degrees, he cannot internally rotate his leg, and he can't adduct his leg past midline. Although patients don't necessarily use the medical terms, I do feel confident that he understands and knows what he can and can't do. So now we'll go ahead and begin starting the transfer. So now before we begin the transfer, I'm gonna lay the bed down totally flat so that when I have him prop up onto his arms, he doesn't come into too much flexion. Mr. Monroe, before we start, I'm gonna go ahead and lay your bed down flat. Is that okay? So to begin, I'm going to see, can you prop up onto your elbows, bringing your arms behind you? So scooting, good. And just, again, being careful you don't reflex too much of that hip. Can you prop up now onto your arms, again, if you feel like it's going to bring you into too much flexion? Good. Okay. So now to begin the transfer, we're going to be moving one leg at a time. Again, remembering the right leg cannot internally rotate and cannot be brought past midline. So we're doing okay? Okay, we're going to go ahead and move this left leg first, move it out to the side. Remember, we want to keep the toes pointing up to the ceiling on this leg. So now we're going to bring this leg over, not moving into too much adduction. Now scoot your arms a little bit. Good. Now we're going to move this leg, move the right leg over. Good. Watch that flexion. One more time. Move this leg. Good. Now, if you can, one hip at a time, start scooting towards me. Being careful of the flexion. Good. Scoot a little bit more. Good. Can you reach to your feet? I'll go ahead and lower the bed so that your feet come down some. Good. And now I'm going to go ahead and move this out of the way so that we're able to get to the chair. Now he also has a catheter in place, so at this point I will hook it to his gait belt so that it doesn't get in the way while we're transferring, so you can just hook that onto the front. Okay. So now we have everything set up for the transfer. Mr. Monroe, what we're going to do is stand and pivot over to sit into the chair, okay? So I'm going to hold on to your gait belt. You can put as much weight as you can tolerate onto this leg, but if it starts hurting, you know that's too much weight. I'm going to block this leg with my knees to make sure that it doesn't buckle or give out. I'm going to grab on to the gait belt around here, and on 3, we're going to stand up. You're going to want to have your patient count for you so that they're in control of the motions. So, you ready? We're going to stand, pivot, and then sit down into the chair. And I will help you as much as you need. Okay, you ready? So I want you to count for me 3.
1, 2, 3.
Good. And now we can turn. Good. And reach back to the bed and that arm of the chair. Come to sitting. Good. Again, reminding them not to flex that hip as they go to sit. Now that Mr. Monroe has transferred from the bed to the wheelchair, we're going to show how to transfer from the wheelchair back to the bed. One thing you want to remember is that he has an IV, and so when transferring to the bed, we don't want it to get tangled on the wheelchair or caught on him at all. So what we're going to do is just lay it over his shoulder so that when he transfers, it moves with him. It's going to be the same process. You're going to want to block that leg, grab onto the gait belt, have the patient count to 3, stand up and pivot and transfer, and have him reach back for the bed to slowly lower himself down. We're going to be transferring to this side, so you definitely want to block the leg, but it's going to help promote strength in that extremity. So, you ready? So, Mr. Monroe, I'm going to go ahead and stand and block this leg. I'm going to hold on to the gait belt. Again, I want you to count to 3. We're going to come to standing, and then we're going to pivot over to this side. And what I'm going to want you to do is reach back with those hands, if you can, to slowly lower yourself. That way, I don't want you to sit like this because you'll be flexing your hip too much. So keep those hips extended and sit back using your hands. Okay? I'm going to raise the bed slightly so that that's easier for our patient to do, so he doesn't have to reach as far with his hands. Okay. Ready? So, on 3 you count.
1, 2, 3.
Good. And we'll reach back with those hands. Reach back, sit down, keep reaching backwards. Good. Okay, now we'll move this IV out of the way. You good?
Mm-hmm.
Okay. So, again, we're going to move one leg at a time. So, you're going to lift this leg up, again, keeping the toes pointing towards the ceiling. Good. And I'm going to help lift this leg up. Reaching back. Good. Stay propped up. Okay. And now I'm going to remove the gait belt. You can come down onto your elbows if you want. Slide this out from underneath him. Place that on the bedside table. And you can lay back down. Good?
That was fun.
So now you're going to go ahead and hook the catheter back onto the bottom of the bed. You're going to want to lift up this bed rail. You don't want to walk around to do that because you don't want to leave the patient without anything on this side. And now you can go ahead and elevate the head of the bed slightly for the patient's comfort. Make sure his IV is set up safely. And you would leave the patient with a call button so that if they needed anything, they could alert someone to come help them. Feeling okay? You did great today.
Thank you.